Okay, I think we're live. Hey guys, my name is Josh Music. This is my dad, Marvin Music. We own this company called MedicareSchool.com, and you're here today with us to learn some stuff about Medicare. So the main thing we're going to be going over is five little known ways to lower your 2024 Medicare costs during open enrollment. And I'm getting a little feedback. You there? Chat if you can, put where you're from, and let me know if you can hear me. So we're in Kansas City. Just if you can hear that, let me know where you're coming in from. Can you hear us? Hello everyone. Okay, maybe we're here. Okay, where are you joining us from? Tennessee, New York, South Dakota, New Jersey, Indiana? Put in the comments where you're joining us from. Our headquarters is in Overland Park, Kansas. So that's where we're sitting tonight. Ohio, Colorado, Florida, Illinois, New Mexico, California, Arizona, Austin, Texas, Virginia, Florida, Utah, Mississippi. It's really fun to think we're talking to people all over the country. Okay, so we're going to talk about 5 little known ways to lower your 2024 Medicare cost. Next week, I'm going to tease you, we're going to have a video out that's actually going to be 25 different ways. So we've searched high and low with every different way that you can save money. So we've got a YouTube video coming out. It won't be live like this, but it'll be coming out and go over 25 additional ways to lower your Medicare costs because everyone wants to save money. But we're going to get into that. After we're done with this 5, we're also going to stick around. We're going to be here for about 75 minutes total answering questions. So it's 5 o'clock our time, so it's 6:15 we'll be logging off. So if you have questions, you can start to drop them in that chat at any time, and then we'll go through them sequentially after we go over these 5. So let's go ahead. What's the first one?
All right. And by the way, these are not in order of importance at all. These are just kind of random. But these are 5 of the ways. The first one I would encourage you to do if you are either already on Medicare or getting ready to go on Medicare, be sure to take the time to reshop your drug plan. I'm really amazed at the 2024 drug plan prices. There are some, in fact, I wrote a couple today that were 0 premium, some 50 cents, but many of them have really drastically reduced their price. And so I would take the time to reshop it. And some have really increased. We had a real common plan that was actually a healthcare plan that went from $28 in most markets to about $62. So almost tripled the premium. And probably very few people really need to be on that plan. So I would encourage you, take the time to shop the plan. Those of you that are on Medicare, you want to make sure that you've got your annual notice of change. And another thing I've noticed this year these companies are doing is they give us some real good pricing on Tier 1 and Tier 2 medications, but on the Tier 3 medications, we saw some that really jumped up quite a bit. So pay attention, especially on those low premium plans. I think they're good. I would encourage you to enroll in one, but don't just look at the premium. You've got to look at your co-pays as well. And so like our system, we're able to show you what an annual cost will be. So take the time to just do your homework, take advantage of some of those better premiums.
Okay, so let's back up. So if you're not sure what your drug plan premium is going to be next year, every plan is required by law to send you something called an annual notice of change, an ANOC. And it's a letter that comes to you generally late September, so you should have it by now. And in that annual notice of change, it's going to say, hey, your premium was this and it's going to this. The deductible was this and it's going to this. The copay for Tier 1 was this and it's going to this. So make sure you go through that. Don't just assume I don't want to change anything. Just look through that ANOC. Now, the reality is still only 10% of people change. So you're probably not going to have to change your drug plan, but we're seeing maybe more this year than ever before where we're seeing these kind of wild price swings, some up, some down. So it's all over the place. If you're our client, we use a system called Medicare School Enroll, and I'll drop that in the chat here. MedicareSchoolEnroll.com, and you can use it even if you're not our client, but you go through that, you can create an account, you input your medications, save the medications, and then every year you just come back, and it's really, really easy to make sure that you're on the correct plan for next year. Our goal is always, and we've said this for over a decade, is in less than 30 minutes, you should really be able to be confident that the coverage you're on right now is good for the coverage next year.
It's good, yeah. I just want to add as well that Medicare did raise the deductible, but remember, even though they raised it, it does not affect everyone because every formulary is going to have multiple drugs that are deductible exempt. And so so it's $545 deductible this year. Many of you will not even reach that. So if your drug list gives you your copay and it says deductible exempt, they're just simply saying you're going to pay a $2 copay or $0 copay or $5, and you don't have to be concerned about that deductible. Now, if you're on a tier 3 medication up, a brand name meds, you're probably going to have to meet that deductible. But the majority of you will not. So don't let that deductible frighten you, especially if you're on your low-cost medications. All right. So
okay, so the first way to save money, just don't ignore what's going on with your drug plan.
that's right.
Okay.
Yeah, and the second also has to do with prescriptions. I think it's interesting. We had a client today that I worked with, and they took 4 medications. 2 of them were 0 premium. One was like $4.50. But one it was a deductible medication. The other 3 were deductible exempt, and the medication was $60 copay. And so we just typed in GoodRx, and that same medication they could buy cash at like one grocery store was like $15. The average was about $25 for that medication cash. So just be sure that before you're going to spend $40, $50 for a medication, see what that GoodRx coupon price is going to be. Mark Cuban has a group now that's called Cost Plus. Drug company, and sometimes there's some great values there as well. And so I'm sharing this with you because you have to keep in mind you do not have to run all your medications through your drug plan. If you get a better price cash, then just pay cash and use your plan when it's the best price.
Yeah.
So that's a great way to save money.
I think one caution though is to make sure that let's say you're on a medication that's going to cost you $400 if you run it through the drug plan, and maybe $375 if you run it through GoodRx.
Right.
Well, the problem with running it, like, if you run it through GoodRx, it's not going to go through your plan, so it's not going to count towards the coverage gap and the donut hole and catastrophic coverage. Right. So you can kind of get yourself into a situation where it's not a good idea to use GoodRx, but in instances like what you described above is obviously great.
Yeah.
And people use it all the time.
Yeah, because if you meet your deductible, then those copays are going to go down drastically. So I would agree. So if you have a medication, probably anything $200 up, go ahead and run it through the plan.
Yeah. Get
that deductible satisfied so you can go into that initial coverage phase and have some very reasonable copays. All right, so that would be 2 things. The third thing I want to remind people about is that, especially for those of you that are high income, you are subject to having to pay IRMAAs. That stands for Income Related Monthly Adjusted Amount. Now, the majority of people do not have an IRMAA. I think right now, 7% of all people have IRMAAs. So 93% of you are just going to pay the base premium, which just came out today. It's $174. What is it? $174.90. So not quite $175. And that's what the majority of you will pay. And so what we have to determine our IRMAAs, they're going to look back at your 2022 income to establish your Part B premium. So we're in 2024, they're going to look at 2022. And so those thresholds this year are going to be, looks like it's $103,000 for a single person that files. A married couple will be double that. So the threshold for a married couple, if we stay below 206, then you're not going to have an IRMAA. So single person above 103 in 2022, a married couple above 206 in 2022 is going to be subject to that IRMAA. So remember, you have the ability to appeal IRMAAs. If you have a life-changing event, and there's 8 events, the main ones we use are marriage, death, divorce, work stoppage, and work reduction, 5 of the 8. But if you have a life-changing event that's happened in the last 2 years, you can appeal the IRMAA, and it's well worth your time to do that. Now, our clients, we do all that for them, and we'd be happy to assist with that. So appeal the IRMAA, and what you're doing in the appeal is you're giving them a new number, a new modified adjusted gross number, the life-changing event, what it is, and the date that occurred. And what you're saying is, don't look back at 22. I had a life-changing event in 23, or I'm going to have one in 24. And so then you have the ability to appeal that. And even if you don't eliminate the IRMAA totally, hey, if you can move down 1 level or 2 levels, it's well worth your time to do that, especially if you're married, because both of you, if you're on Medicare, are going to have IRMAAs.
Yeah. And a lot of people think, how can I get proactive about appealing the IRMAA? And the answer is no. In January, you will get a letter, right? And that letter is going to say, hey, your income-related monthly adjusted amount, meaning because you're higher income in 2022, because that's what 2024 numbers will be based on, it's going to say, here's what it's going to be. And so it's just a good idea to appeal it.
Yeah, Josh is right. Wait till the letter comes. You cannot appeal it before, nor can you appeal an IRMAA before the event has occurred.
Yeah.
Because you can change your mind. So that event has to be in the past.
Yep.
But in the last 2 years, and you can use that event, both spouse can, since you file a joint return.
And the most common is obviously work reduction or work stoppage, meaning you retired, I don't make that amount of money anymore, so here's what I do make. So please adjust my Part B premium down according to what I make now.
Exactly right. And if it's work reduction, they don't ask you how much. I mean, if you literally are going to see that income go down $100, you can absolutely, I mean, that's an exaggeration, but they're not going to say, well, how much did you have work reduction? I've had people that were 40-hour and just went to 35 hours or whatever. So you have an appealable event by just a slight reduction.
Yeah. And then one of the big questions, I'll just go ahead and answer it now because we're going to get it later, I am sure, is what if you do like a Roth conversion or you pull money out of a 401k? Does that count towards your IRMAA? And the answer to that is yes. Right?
The amount of money.
Yeah, the amount of
That's
money.
right.
It definitely counts towards your income.
You can't appeal it because you did a rollover or a conversion.
Yeah, but let's say you did. You pulled out $200,000 or something, so that bumped you up your IRMAA levels. Mm-hmm. As long as you've retired since then, right? You can go ahead and appeal that because Medicare doesn't, or Social Security, they don't care where the income came from. They just care you had a life-changing event within the last couple of years.
That's right. Yeah, they do not source that. So that's really the benefit of doing the conversions at the right time if you're doing it right around retirement, because then you can use that as an appealable event, even though you know it wasn't really because of that, it was because of the Roth conversion. So it's a good idea. All right, so those are 3 ways. Fourth way.
Yep, go for it.
Yeah, those of you that are on supplemental plans, and I think you know those of you who know us, we prefer supplemental plans just because we know the quality of insurance you get with a supplemental plan versus Advantage. And so those of you that are on supplemental plans, you may want to, especially if you've been on for a few years, you may want to reshop those plans. There are times when the group that you're in has had maybe some more drastic or more frequent increases in premium. So it's wise to reshop them to reset the clock. And so if you've been on that supplemental plan for 3, 4, 5 years, we're happy to do that for you. Shop it to see if you can get a better rate. Those of you that are on F plans, you were born before January 1st, 55, you may want to look at a G plan or an N plan. And so not only do we want to reshop it, but sometimes people actually change letters, move from an F to a G or an F to an N, or maybe you're on a G plan and you would like to move to an N plan to be able to save some money. And those are fine ways to do that. The benefits of having a supplemental plan where you have no networks, no pre-authorizations, lifetime plans, all of those are going to exist within any of the supplemental plans. So I think it's well worth your time to do that. Most states you're going to have to qualify to make that move. Some states not. But if you have to medically qualify, and hey, I did one right before I came in here and had a guy kind of questionable, diabetic. He had 2 hypertension medications, a third one kind of questionable. So I told him, hey, what we can see. It didn't cost him money to try. Yeah. And so I think he has a shot. His wife's very healthy. She's going to get to move for sure.
Okay, so that's a good pause. So my dad and myself, we own a company called MedicareSchool.com, and we do 2 things. We educate people about Medicare, which is hopefully what's happening right now. And secondly, we have a team of people, there's about 85 of us here, who every single day come into work to help people make sure they're on the right supplement plan, Advantage plan, prescription drug coverage, that sort of thing. So it's the annual enrollment period, or at least it starts here in about 3 days. And so if you want to make any changes to your coverage, and you're not our client yet, we're going to go ahead and put the phone number. Let's scroll the phone number along the bottom. We'll put the phone number along the bottom so you can give us a call, and we would be honored and happy to help you. If you are our current client and you're saying, okay, I want to figure out if I need to change plans, we have a dedicated coverage renewal team. Okay, so it's people that we pay for all year, really, just to have them around during this 7 or 8 week period of annual enrollment period to help you guys switch your plans. So you can call in. We've sent some videos out and stuff for you guys to learn how our process is. So we'll get you plugged in, give you the health questions, help you shop those plans and make those changes as you need to do.
It's good. Good. Yeah. And remember, if you're on an F plan, you go to a G plan, the only difference is you would be responsible to meet your B deductible. F was the plan that covered 6 of 6 Medicare gaps. G covers 5 of 6. Every gap's covered by the G plan, but the B deductible. This year it's $226. It's moving to $240 next year. Yep. And so you meet that once a year, so still an awesome plan. And those of you that would, maybe you want to save a little more money, you could go to an N plan. N plans are fine plans. It covers 4 of the 6 gaps. It will not cover the B deductible, and it will not cover excess charges, which frankly are becoming very rare now. I would say less than 5% of the time where we're going to see a doctor charge an excess. But with the N plan, you do have some copays. You're subject to them. In fact, I had a lady today that goes to the doctor regularly, had a lot of health problems, and she went with a G because she didn't want to pay those copays. But the point is that could be another way for someone to save money if you're on a G, and we can get you health qualified, move to that N, and reset the clock. All right. So,
cool. Okay.
Last one that I want to mention.
Then we'll do question and answer. So there are a lot of questions already popping in. Go ahead if you have a question. Go ahead and put it in the chat, and then we will get to as many as we can for about an hour.
All right, sounds good. Let me just mention this one. And this would be for those of you that are either on a very tight budget or you're on a supplemental plan and things are starting to get tighter in your budget. You may want to consider looking at a Medicare Advantage plan. When you take a Medicare Advantage plan, almost all of them today, in fact, 70% of Advantage plans today have a 0 premium. Now, you don't have a premium to the insurance company, but you still are going to have to pay Medicare, the Part B premium. So it's not like they're totally free premium-wise, but typically the insurance company charges nothing for the Advantage plan because instead of a premium, you're just simply going to pay as you go. So if you do switch to the Advantage plan, be sure you're comfortable with the copays to a specialist and to the hospital and for an MRI and a CAT scan and outpatient procedures because you're going to pay as you go. And then they set a limit as to what those copays will be. Those are going to range this year somewhere between about $3,000 to $4,000 on HMOs and probably $4,000 to about $7,000 on PPO plans. But if you need to save money monthly, that's what you're looking for, then Advantage plan would be a way to do that. Now, if you get sick, I'm not saying you're going to save money, but it is a way you can at least cut your out-of-pocket expenses for monthly. So just take the time. I would say this, I'm not a real fan of HMOs. I know they make them a little more favorable, lower out-of-pockets and lower copays, but you have to stay in that network, and that's my concern about HMO Advantage plans. You have to stay in the network unless it's an emergency or urgent care, and so you're very restricted with that. PPOs, you can go out of the network, so you have a little bit more flexibility. And just 2 things, and I'll be quiet. I want to make sure you know that if you do make that switch to the Advantage, you still have to live with pre-authorizations. And frankly, that's one of my real beefs because the insurance company can run interference, and they do sometimes. They deny CAT scans and MRIs and certain knee or hip replacements. They have the right to do that. So that can be very frustrating when you experience that because pre-authorizations are a reality on Advantage plans and never on supplemental plans. All right, so just have to be aware of that, but that could be a way to save money.
Absolutely. If you are our current client, and you're just going, man, these supplemental plan prices, I just don't want to pay it anymore. Maybe inflation's just hit you too hard or whatever. Don't be insurance poor, right? Yeah. Give us a call. Give our team a call, our coverage renewal team. They will literally walk through and help you find the best Advantage plan for you.
Yeah, and
no shame in that, right? Just give us a call. We'll help you.
Not at all. But I will tell you this, Josh. I had people I talked to today. Been with us a long time. I think total, they're both on MedSups. Total premium together is about $430, and I shopped it. And if they both get approved, they're going to save over $100 they're still on G plans.
Okay.
But when with the different care, offered a 20% household discount, and so $100 a month.
Wow.
So they were excited about that. So there are ways to do it and still stay on SUPs, possibly.
Yes. Here, I'm going to put another link in the chat here because this is going to be the best thing. Instead of calling us, this is the best way if you want to change your supplemental plan. We're going to send you to a video. So everybody write this down. Okay, I'm going to put it in the comments. Can we put up a thing? Let's put up a banner that says changemysup.com. SUPP. Changemysup.com. Go to changemysup.com. There's a video of Marvin in there talking you through how to change your plan, how to get an appointment with us, with our coverage renewal team to help you shop your plan. So he's going to go ahead and put that ticker up there.
Yeah. And do it soon, too, because of the underwriting required.
Yep. And then put up change my ADV as well. If you're on an Advantage plan and you got your annual notice of change and it says like, just this plan is changing a lot, or you've heard from friends that there's a better plan available, you can also go to changemyadv.com, which stands for Advantage. adv.com. Yep, there you go. Put that one up there. And it'll be a video from Marvin walking you through our process for helping you change your Advantage plan, show you how to get an appointment with our coverage renewal team. Okay?
All right, let's get to questions.
Let's get to questions, okay. We'll start with the very first one. Mary Walter, hopefully you're still here with us. You said, I just signed up for Medicare. Just signed up for Medicare and supplement. Will my price go up in January? So your Part B price is going to go up. It's going to go from $164.90 to $174.90, right?
Yeah, it went up 70. That's a 7. 174.70.
174.70. So what was that? $9?
$9.80.
Okay, so it went up almost $10 for Part B. As far as your supplement price, it's going to depend on the carrier. Carriers, everyone thinks that supplemental plans are all going to go up on January 1st. That is not how it works at all. So please don't call our office and say, what's my price going to be next year for my supplement plan? Because the answer is we have no idea. Supplemental plans, sometimes they happen on the first of the year. Sometimes they're tied to your policy anniversary. Sometimes they're tied to your age. A lot of companies take their annual price increase between April and July. And so it really varies across the board. But here's what you'll always get. 30 to 60 days before there's any price increase, you're going to get a letter. And it's going to say, hey, your premium went from here to here. And that's when you kind of trigger yourself to go, hey, does this look like a reasonable increase? Is this 5, 6, 7%? Or is this a 20% increase? If it's an unreasonable increase, then give us a call. So if you call us now and say, what's my supplement price going to be next year? We don't know. Yeah. So it may go up, it may not go up.
I will say this, the norm is that they lock that price in for 12 months.
Yeah.
There are exceptions, but usually you'll have that same price for 12 months, and then you'll find out about your increase, if any, at renewal.
Okay, next question. Gary Habner. I turned 65 in 10 days. I've heard my employer needs at least 20 employees on the group health plan to delay Part B. My employer says they need 20 people on payroll, not the group health plan.
It's payroll. Yeah. It's not, and your employer's right. It's the payroll. So as long as there's 20 or more on the payroll, you're not obligated to do anything at all with Medicare. 19 or less on the payroll, you have to go on Medicare A and B.
Now, since it's a small employer, I don't know if I can say this, but they're probably paying a lot to have you covered. So sometimes you can work with that employer to say, hey, if I go to Medicare, what can we work out? Because Medicare is going to be better coverage for you, be better for the employer, better all around.
Right.
So just don't, you can be a little creative with that.
Yeah. And if your employer really is paying any more than, $350 a month
which
for you, which I'm sure they are, then it would be a lot better for you to go ahead and take Medicare, pick up a supplemental plan, drug plan, and you win and they win.
Yeah.
You have a lot better coverage, much lower deductible, and they're going to be out of pocket less as well. Now, listen, if you're high income, you're making about $500,000 a year, that could change the scenario because of your IRMAAs for sure. But for 93% of all people, it benefits them to go on Medicare and the employer as well. Yeah, they can't pay it for you, but they can sure give you a pay raise.
Okay, going back up here. Okay, if I'm satisfied with Humana Choice, do I need to do anything?
Not at all.
Not at all.
Not at all.
It'll auto-renew. Unless you, this happens very rarely, unless you get a letter that says, hey, your plan's not going to be available next year. But that is very rare, and what they'll do is it's called a crosswalk, they'll move you over to a different plan. So,
right.
No.
As long as your providers are still covered on that, then you don't have to do a thing.
Yep. Okay, I am going to turn 65 in 11 months. I am self-employed and presently pay $1,800 a month for health insurance. What do I need to do and when? That is a lot to pay for health insurance. So you're going to feel like you're getting a maybe $1,500 a month pay raise. So my recommendation would be is make sure you go to MedicareSchool.com, watch our education. So there's a workshop on there. It's about an hour long. And it'll give you a really good A to Z overview of the entire Medicare system and what your options will be. And then probably about 3 to 6 months in advance, give us a call. We'll help you enroll in Medicare A and B. We'll help you pick out a supplement plan, drug plan, or an advantage plan, whatever makes sense for you. Really just hold your hand through that entire process so there's no hiccups or mistakes or anything.
That's right.
Let's see. Miss Mischief said, I'm 68. I have Medicare A and B. I work full-time for a corporation and have health insurance, but I'm getting laid off. Will I be able to get a Medigap policy? If so, should I get an F or a G?
Okay, so you're 68, so you were
She has
born.
A&B. Wow.
Yeah, when was she? When was she born?
Well, that would be 2023 minus 68 would be 1955.
Okay,
Yeah.
very good. Yeah, that's what I thought. So the way it's going to work for you is you are in a status what we call guaranteed issue. So when there's voluntary or involuntary loss of a group plan when you have Medicare, you will be able to pick up a MedSup plan without underwriting, but that would only be a G plan in most states. I think Florida allows an N as well. But you can't just get anything. You have to get a guaranteed issue product. Now, if you were born in 1954, it would be an F plan. But they changed the rules, and anyone born 1955 thereafter, guaranteed issue product has been a G plan. So you'll be able to pick that up. And no underwriting whatsoever. Now, if you decided that you want to get an N plan, then to get that would not be guaranteed issue. You would have to go through underwriting unless you're in a state that makes insurance companies cover the N. And only one I know of is Florida for that. Yeah. Okay. So no F, but yes on the G.
Okay, Johnny D says, my Part D drug plan is almost doubling next year. Is this with most plans? It's from ARP United. That's the plan you were talking about,
right.
doubled. So no, most plans aren't doubling, but we are seeing that. Make sure you go, Johnny D, go to Change My PDP, changemypdp.com, and you can input your meds or watch a little video, input some meds, and then it'll tell you if you're on the right plan, because that still may be the right plan for you. We don't know, but it probably isn't.
Yeah. Yeah, and what you're looking at is the annual cost. Josh is right. The premium is not the big factor.
Yeah.
What matters is what's going to be the total cost for all your meds, premium throughout the whole year.
In most markets, there's like 25 different drug plans, and they're all going after a little bit of a different segment of the market. So it could be that plan that you're on, is one of the only plans that covers a specific medication at, a reasonable cost. So it could be that that's the right plan, but it's a good idea to go ahead and shop it. Yeah. Okay. George Stewart says, if I enroll in Plan N, can I switch to Plan G later on without underwriting, or a high deductible G to a regular G? Please explain how this switching works.
Mm-hmm. All right. No, you can't. Anytime that you're going to change letters and into a G, because G covers more, you can, with some states, some carriers make a downward move, meaning a G to an N without underwriting, but into G, meaning you're going to get a better policy. You're going to have to go through underwriting in order to do that, except in New York, Connecticut, Maine, or Massachusetts. Those 4 states, there's no underwriting ever. And so that process is what you're asking, how do we do that? Then in order to switch a plan where there's underwriting required, you are going to, we'll have to ask you 25, 30 health questions. We're going to check all your medications, maybe get a statement from your doctor that's submitted to the insurance company, and they have every right to say no to that application. They can deny that when you're making a switch beyond your first 6 months of your B date. First 6 months of B date, they can't deny you, but after that, they can. Now, the same thing is true if you're on a high deductible G and want to move to a regular G, you definitely have to go through underwriting. And that's one of my problems with high deductible G plans. I mean, I know the premium's less, but if you can't get off of them, now you're subject to whatever the government sets for the high G out of pocket the rest of your life. And so I'm not a real fan of those. I think you do serve yourself better if you're trying to save money versus a G. I just do an N plan instead of a high deductible G.
Okay, Pamela, do you know of a new Advantage plan with Aetna? I believe it's cheaper and better coverage. There's always new Advantage plans coming out every single year by most of the carriers. Now, whether or not that's in your market, that's a different question. But give us a call. Go to changemyadv.com. Watch the video, schedule an appointment, and we will help you compare all the Advantage plans in your area, or all the ones we represent in your area, and help you determine which one's right for you.
Yeah, I was going to tell you, in 2023, there were 5,200 different Advantage plans, 190 different companies. That's across the country.
Yeah.
So it'd be impossible to say,
is there a new one?
New one? Yeah, could be.
Okay, I live in Minnesota and Plan G, etc. are not here. Minnesota has its own version. What do you know about the differences?
Okay. Well, the way Minnesota works, you're right. They do this. Wisconsin does this, and Massachusetts.
Yeah.
They don't operate with the standardized plans. However, there is a plan there that will be almost equivalent to a G plan. They're going to call it something different. You may have to have a writer to make it that, but we write in Minnesota all the time, and so we'd be happy to help you with that. But you can get an equivalent G plan in Minnesota for sure.
Yeah, absolutely. And then there's also an equivalent for N. It's called the PBCO.
Yeah.
But yeah, we just call our office. We'll help
Yeah.
you. We'll help you sort all that out. Okay, let's go to let's see. How do I find a program to help pay my Part B premium? Medicaid denied me.
Yeah.
We can hear you, Houston, Texas. Yeah, I don't think there is.
Yes,
Medicaid
yeah.
denied.
If Medicaid will not help you with your Part B premium, I don't know of anything. The Medicare helps people pay for some of their Part D prescription drug costs, but not for Part B premium. That has to be a state Medicaid program.
Okay, Leslie Totten says, hello from Oregon. I'm very satisfied with the way you folks set us up last year. Thank you, Leslie, for letting us help you. You have A, B, and G. Just need to know options for dental RX. Give us a call. You can also go to our website and kind of choose that you want to talk about dental. If you're just wanting to switch your RX plan, go to changemypdp, prescriptiondrugplan.com, changemypdp.com, and you can see our process get plugged into that. Again, take you 15, 20 minutes to make sure you're on the right drug coverage for next year.
Can we just make a comment quickly
Yeah,
about
yeah.
dental?
Yeah.
You know, when it comes to dental plans, the very best time to buy a dental plan is as you're leaving work.
Yeah.
Because when you lose employer plans, as long as you made a decision within 60 days of losing employer coverage, then the company you go with almost always will waive the waiting periods. So you can get wonderful coverage right out of the gate. If you wait beyond 60 days, then sometimes you're going to have to wait a while before you're going to get really good coverage. And there's three things about every dental plan. They have three types of services: preventive, basic, and major. Preventive is obvious: a couple cleanings a year, set of x-rays. The basic services are your cheaper type services, extractions, fillings, those kind of low-cost items. Those are normally covered at 80-20 or 90-10. Plan pays 80% or 90%. You pay the other 10 or 20. And then the major services almost always are 50-50. This would be crowns, root canals, implants, those kinds of things, 50-50. And so when you look at a plan, you want to see how it's structured, but the most important thing is what's the annual benefit on the plan. We have plans that are pay $2,500 to $3,000 a year. That's a very, very nice plan, especially if you have teeth issues, problems. And so look at the plan, how it's structured, but then how much will they contribute? We have one plan that's $2,500 and doesn't include cleanings. Another one's $3,000, which does. So the point is, when you look at those plans, be sure that you pay attention to that overall benefit, because that's really what matters. Premiums are about $45 to $50 a month.
Okay, next question. How do you look up RX drug plans for Part D? Go to changemypdp, prescriptiondrugplan.com, and it will guide you through the process.
Yeah.
Okay, for the supplemental plan, do you have to have a separate drug plan? And the answer is yes. There are no drug plans that are embedded in supplemental plans.
Yeah. If you want a drug plans are optional. I think it's wise to get one, especially now with the low cost. But you're right, you don't have to have. They truly are optional. The reason I suggest it is because you may not need meds now, but you could in 3 months, and they could be expensive. Plus, if you don't take a drug plan when you're first eligible, you're going to be penalized.
Yeah.
And so you would not, in my opinion, I would not go without a drug plan.
And not only will you be penalized, you will be not able to sign up for that drug plan like just whenever you want. So let's say you don't take a drug plan, and then it's February, right, and you get on a medication that's $500 a month. You're going to be out of pocket on that drug plan until the following, or you're going to be out of pocket on that prescription drug until you're able to get a drug plan during the annual election period, which is happening in 3 days from now, and that coverage won't start until January 1st. So you could be out $5,000, right, for that because you chose not to get a $10 a month drug plan.
Yeah, or a 50-cent dollar.
Yeah, there's one for 50 cents in some areas right now.
Yeah.
Okay, do you help your established clients with billing discrepancies?
Absolutely.
Give us a call. We'll help you walk through that. for sure.
Yeah, let us know. And by the way, I just want to answer that question. We are happy to help always. But I'll tell you this, the last thing I would do would be calling Medicare right out of the gate.
Yeah.
Call us. If you're not with us, then you call the insurance company you're with, just because they should be able to kind of dissect those materials first. So.
Okay, if you have to pay for Part A and B, what is the best plan would you suggest? We're generally going to suggest, if it fits within your budget, a supplemental plan G or a supplemental plan N. If that doesn't fit for your budget, we're going to help you find the right Advantage plan.
Yeah.
So it really doesn't. We're pretty agnostic in terms of what is right for you. Everyone's situation is different. So we'll help. This month, probably 3,000 or 4,000 people get on plans, and probably 70% will be supplement plans and 30% will be Advantage plans, just for our mix of business.
No, it's sad she has to pay for A.
Oh, if you have to pay for Part
Yeah.
A, I didn't see that.
Yeah.
Oof.
Yeah.
Part A is like $400 a month.
Well, it's $278 if you have 30 to 39 quarters. It's $506 if you have 29 or less.
Okay.
Monthly. Hopefully, Rose, you can either go back to work and start working towards that, the premium free A, or you can pull from a spouse or an ex-spouse. So I hate that you have to pay for it.
Okay, we just covered this, so we're not going to spend long on it. I need a better dental and eye care plan. Help, give us a call. Phone number scrolling along the bottom will help you do that. Okay. Medicare D, the way you determine which plan is most cost effective is based on what meds you take and the frequency they are filled. Bottom line. I mean, yeah, obviously you want to look at the premium too, but if you use our site, which is called Medicare School Enroll, you can, it basically tallies it all up, and it says this is how much it's going to cost in January, February, March, April, May, June, July, August, all through the year, and it includes the premium, it includes any deductible, it includes any copays, it includes if you go in the coverage gap or the donut hole, it includes if you go into catastrophic, and it just says, and you always sort by what's the lowest estimated out-of-pocket cost, and that lowest estimated out-of-pocket cost for the entire year is going to be the plan up at the top. Okay, and that's what we generally will recommend. Now, if you're on a plan and you log into our site and that plan is showing out number 2 or 3 and there's only a $10 or $15 or $100 difference maybe for the year, you've got to make a decision on, is it really worth switching potentially pharmacies? Is it really worth switching insurance companies to save $100 a year? For many people, it's not. Yeah. But I think that answers that. Okay, Eric VB, want to return from an Advantage plan to a supplemental plan. First year supplemental, this year Advantage, DT dental benefits. Do I have to go through underwriting? Maybe, maybe not. Generally speaking, we want to set the expectation that yes, there is something called a trial period. However, it's tricky. Not everyone applies. Insurance companies generally don't like it. So
states differ.
Yeah, states differ. So the answer to that is probably yes, maybe no. If you contact us, we'll be happy to walk you through that.
Okay, yeah. So if you are within your trial, right, the answer to your question is you wouldn't have to go through underwriting if indeed you have a trial.
Yeah, if you have it, yeah.
So that really depends upon where you live, your A and B dates, and also got to keep this in mind. If you were on a sup and you went to an Advantage, you want to go back, you have to go back to the same company. You cannot switch companies without underwriting. Yeah, so you got to be careful with that.
Okay, this is an interesting question or statement. My drug plan through Utah Public Employees Health Plan right now is enhanced. I had unused sick leave or retirement that covers my plan premium until September 30th, 2024. I take 3 expensive ones. That's not really a question, but...
Well, yeah, here's the issue. As long as you have a statement of credible coverage for that plan, then you can stay on that plan. Even after you retire, it'd be a credible coverage plan.
Okay.
Yeah, and they
even without Part B.
Is that what he says?
No, he doesn't say that, but
okay.
We don't know if he has Part
I
B.
didn't use sick leave. Okay. Well, but you're eligible for a drug plan just with A. So I thought he was addressing the
he is addressing the drug plan. I was
plan.
expanding out to see if he's going to have issues down the road.
You will not, as long as, and they have to send those out annually, saying that this is credible, which means it's as good as or better than a Medicare drug plan. Then you can stay on that. Now, I'll tell you what's going to happen. Keep all your records, because when that period of time ends in September 30, 24, and you want to pick up a drug plan, you're going to have to prove credible coverage.
Yeah.
And so those credible coverage letters will be the way, and that way you can avoid the penalties.
Okay, Sandy P said, I just signed up for a drug plan effective November 1st, 2023. Do I have to sign up again for 2024? The answer is no. Like, that plan will auto-renew unless you get some letter that's saying, it was canceled or something. It's a good idea to go to changemypdp.com, double check, make sure you're on the right thing for 2024, because what if that premium was $28 in November, December, then went up to $66? You're going to be pretty mad.
Yeah,
come
you're not
January.
required to change. That's
Yeah.
but you should check to make sure whether you should stay on it or not. So let that annual notice of change give you the proper information for sure.
Mark Copeland, on a low-price drug plan, doing BM biopsy tomorrow. If positive and treatment starts, can you guys help review the meds list for a more cancer-friendly drug plan? Go to changemypdp.com, and we'll walk you through the process. Let's see. Okay. You have something to say to that?
No, other than the majority of cancer meds are going to be covered through your Medicare A and B. If you're in the hospital, they're A cover them. If you're outpatient, B is going to cover them. So I know there are some now cancer meds covered by drug plans. So I think you're wise in doing that. But traditional chemotherapy and such covered through B.
Okay. I'm getting a notification. I need to include some Facebook comments. So I've literally just been going down. We're only at 5:08, so we're 30 minutes behind here in terms of when the comments are. Let me find a couple from Facebook. Hang on, if they will load. Okay, we have Medicare A and B as well as supplemental dental plans. Are there supplemental eye plans on Medicare A and B?
Mm-hmm. There is. Some dental plans will include the option of having a vision benefit. The one that we write is they give you an iMed network or a VSP network. iMed network's typically about a $10 add-on. VSP is about a $14, $15 add-on. But I want to mention something. I think those are wonderful plans as long as you get glasses regularly, because you do not need an eye plan for glaucoma, cataracts, and a lot of different diseases of the eye, because Medicare's are going to cover that very, very well. So only get that add-on for vision if you need glasses or contacts. That's it. It's not going to help you otherwise, because Medicare covers everything else other than routine eye exam. Yeah. So I'm not anti plans, but just be sure that you're going to be able to use it. They're low cost for sure.
Okay, Kathy White-Stum, if I begin Medicare A in 2019 but not taking B until 2024, can I have the F plan?
Mm-hmm. She can.
So,
yeah. You're eligible for Medicare before January 1, 2020, so you'd still be eligible for an F plan. I would tell you, though, Kathy,
Don't get it.
I looked at one today, and it was literally $90 more a month from an F plan to a G plan. So what are you doing? You're paying, it'd be $1,280 a year for a B deductible benefit. B deductible this year is $226, next year $240. So you just paid $1,000 a year extra for that F plan.
Yeah.
And so it's just not a good value. Now, if you happen to be in a market where such is not the case, then go for it. But I just don't think. And I'll tell you another thing about F plans: so few people are getting them today. That pool of F plan is going to be very small. Therefore, the rates are not going to be as stable. So I would encourage you, even though we all love full coverage, it's just not a good buy. Get that G plan. It's almost full coverage. You got to meet your B deductible.
Okay, scrolling back on here. Let's see. Will the VA fill prescriptions that are written by civilian docs?
Usually not. Yeah, I think they only want to fill them when they're from a VA doctor.
Okay, why is it that some brokers promote Advantage plans and others like yourself promote supplemental plans?
Well, here's what I think it boils down to. Those of us that are in the business full time, day in and day out, we see the consequences of Advantage plans. Doesn't make Advantage plans bad, but there are some consequences that people can be terribly disappointed in. And a lot of it has to do with skilled nursing discharges. It's usually early, before people should be going home. I mean, I have stories of death because of it. Pre-authorizations are frustrating. People want a knee replacement, and the plan says, no, you're going to have shots in the knee, or you're going to try therapy before we approve the knee replacement. Same thing happens on hip. Lady needed a hip replacement. Advantage plan said, no, we'll pay for a rod only, not a full hip replacement. So those kind of things happen. So those of us that are in the business that service clients and take care of people, we see the kind of the dark side or the negative side of Advantage plans. Now, if all I cared about was my commission, then I'm going to push Advantage plans. Why? We make twice as much money and we get paid lifetime residuals. So the people who care only about commissions are going to only talk about Advantage plans.
Which is why there's so many commercials about it. There's just more money in Advantage plans.
Yeah, true. I mean, it's a $400 billion business, and companies make more money on Advantage plans, and therefore they're willing to pay the agents. And but an agent is going to service people and has a conscience about what is right and wrong. And by the way, we'll write Advantage plans.
We write thousands of them a year.
But we're going to tell you about both options. Why? Because you got to live with the consequences. If I'm chasing my commission, I'm only going to talk about Advantage. But if I'm chasing to help you to make sure that you understand your options, what's going to be best based upon your budget and your risk, how much what you're comfortable with, then we will tell you about both. And then ultimately you're going to decide that. Why? Because you have to live with that choice, and that's all we care about. And there's a lot of other people in this business who have the same feeling as we do. Why? Because they service people. Yeah, they don't just work out.
Most of the companies that are filling up the airwaves that are either, I don't know if they've started yet. They're probably ramping up to start Sunday or Monday, which is the 15th. What they do is they keep a bare bones skeleton crew, just enough to kind of keep the lights on during the year, and then they hire 500 or 1,000 or 1,500 brand new to the insurance business agents to sell Advantage plans for 7 weeks, and then they lay them all off, right? And so there's just so much money and so much commission that can be made in these 7 weeks. There's so much stuff filling the airwaves that there's just all this energy and all this money that's flowing. And what ends up happening is the newbie agents, they don't know. They were just taught, this is what you're supposed to sell. This is the free thing. And they're never going to think about Medicare, next year or ever again. It's just in and out, in and out, in and out. So we've been doing this since 2010, 2011. And so we've just seen all the different sides of it.
Yeah.
Okay, I am planning on signing up for a start date of late January 2024. I probably need to revisit the basic presentation to understand the process. Yes, go to MedicareSchool.com. You can sign up for the workshop. The 2024 workshop we will have updated shortly. It will be very similar to the 2023, but I'll have the new numbers. Go watch that and then give us a call. We will be happy to help you. In fact, right now is probably the right time to reach out. Anytime 90 days in advance. So if you're starting January 2024, that's perfect. So, okay. Okay, this is a can of worms. Isn't the donut hole gone for 2024?
Not at all. Not at all. So the donut hole still exists. What is gone really is the financial responsibility that we have in stage 4 called catastrophic. That is now zero copay, but the donut hole still exists. And what will happen next year is if you have a total retail cost, total retail, not your cost, but total retail, of $5,030.
Meaning
that's the threshold retail before you get to the donut hole.
Okay, can we explain that?
Oh yeah, okay.
So in January, you're going to start getting meds filled, right? And let's say you're on a medication that's $500. Now you might maybe you have to pay the deductible the first month, or maybe you just have a $40 or $50 copay, right? What he's talking about is the retail month over month starts to add up. So $500 in January, whether or not you paid it. $500 in February, now we're at $1,000 retail. Maybe you've only paid $100 out of your pocket. Then $1,500, then $2,000, then $2,500. So when that adds up to hit, what's the threshold?
$5,030.
Then what happens?
Then you will go into stage 3, which is called the coverage gap or the donut hole. So the donut hole still exists. And while you're in that donut hole, you will have a 25% co-insurance will be your copay. So if you're on a Eliquis that costs $600 retail and you're in the donut hole, it's going to cost you $150 a month. So the donut hole still exists. If someone says it doesn't, they're wrong. Now, we won't have it in 2025. It is gone in 2025, but we still have it next year. But again, Josh is right. So as you get prescriptions filled, they're tracking the total retail cost. And as that retail total, not what you're paying, but what you and the plan are paying together is retail. And once that reaches $5,030, you will be in stage or phase 3 for sure. It does exist.
Can you list the Part D plans with zero premium for 2024? I don't know them.
Well, I don't either. No, I'm sorry. I do know. I mean, one today was WellCare Value Script.
Yeah, I think it's mainly a WellCare plan.
Yeah, WellCare plan. It was zero. Across the state line, it was 40 cents. So that WellCare Value Script plan has been typically anywhere from about $7 to $15. It's gone down to zero, or 40 or 50 cents a month.
And what all these companies do, right, is they're always trying to get market share. So they're going to come in and it's going to be zero for this year, and then it's going to bounce up next year. I mean, maybe not, but that's just generally what happens.
But you can always switch.
Yep.
Yeah. And really, if you take no meds or you're on a few generics, I think that's a wonderful plan.
And I also want to say something. We're not supposed to disparage any insurance company, obviously.
Did I do that?
No, we're not. And so
we're not.
Take this the right way. Make sure you check out the star ratings of WellCare plans. Don't just go for something because it's zero. And we recommend WellCare all of the time, all the time. But don't always chase the zero. Okay. Does Medicare look at 2022 income automatically for IRMAA adjustment? Yes. Yeah. So in 2024, January of 2024, it's all gonna be automatically calculated. They're gonna look back and say, okay, what did they make in 2022? Right. And then they're going to calculate that IRMAA based on that. Now, if you've had a life-changing event like death of a spouse or divorce or work reduction or work stoppage, or I think there's 3 or 4 others, then you can go ahead and appeal that and get that IRMAA dropped. Okay? We'll be happy if you contact our office. We have like a tutorial video that walks through that. And just makes it really, really easy, kind of walks you through what you need to think about and how to fill out the form and where to send it and what to do to get that IRMAA dropped. Okay, from Olathe, Kansas, what's the best way to compare my and my wife's Medicare B and D plans? We have Plan G Medigap plans. So if you want to compare, I want you to go to Change My SUP, SUPP. So Change My SUP, SUPP, which stands for Supplemental Plan. There's a video of Marvin on there, and then there's the ability to book an appointment with our coverage renewal team that will walk through exactly the easiest process for getting that supplemental plan shopped and changed.
Yeah. And if we have to go through underwriting, we write for a lot of carriers, so we know what carriers are kind of prone to give us a little bit more liberal underwriting. And so we're familiar with that. If someone's squeaky clean health, they can get through with anybody. But sometimes we'll have a case approved today. I was shocked. So we'll go for it.
Okay, Nuke Russ says, I'm in New York. I have the G plan with a current monthly premium of $243.80. Univera, whoever that is asking the state agency, which controls their premium, to increase my premium by 66%. Can they do this? Sure, they can ask. Here's what I would say to you. If you're in New York, you should not be on a G plan. Mm-hmm. I mean, you really shouldn't be on a G plan.
The IN's a better value.
Yeah, the IN plan is way cheaper generally, and there's no excess charges in New York. So unless you were to get coverage outside of New York, that in a state that had an excess charge, which is going to be kind of few and far between anyway, you switch to an IN. Call us. That number along the bottom of the screen, give us a call. We'll help you get on an IN.
And it's year-round open enrollment.
There's no health questions in New York. So just call us. We'll help you make a switch. We'll get you on a plan that will be a lot more rate stable than that.
You can probably get that effective November 1.
You don't have to wait till January 1. If you call us today, we can more than likely, start that November the 1st. Okay. If you're affected by an IRMAA and you choose an Advantage plan with no premium, what happens?
Yeah, you still have an IRMAA because the IRMAA is going to be on the B. In fact, you'll even have the IRMAA on the D as well. So you can't get away from the IRMAA by being on an Advantage plan. It will not happen. Most Advantage plans have that built-in drug component, so they'll pick up on the D as well. So, got to pay it. And by the way, it's a great problem to have. Okay, it just is.
This is a good question. Do you recommend supplemental versus MA plans for folks on FEHB?
Okay. Here's the issue with FEHB, and for those of you that are not familiar with the acronym, it stands for Federal Employee Health Benefits. These are people retired civil service, FBI, IRS, Homeland Security, Treasury Department, those kind of people. They have FEHB. And so the only problem that I have with an FEHB person going on a supplemental plan is you have to sign a form saying that you are, for the rest of your life, terminating your FEHB benefits. And you have to check the box and do that. And so, boy, it's tough for me to tell people, are you sure you want to do it forever? Now, I've had lots of people do it, and the reason for that is because their FEHB option was not very attractive. In other words, they looked at the normal Medicare supplemental market and said, hey, this is a better deal than what FEHB is offering me. And so then I think that's still a good decision. But if you are in a good FHB plan, which would be probably GEHA or FedBlue, then what we oftentimes will do is do an MA only plan, because a GEHA or FedBlue will give you a credit. Right now it's about $800 a year towards your Part B premium. And then if we do an MA only plan, well, you're going to get probably about $100 or so credit on your Part B premium as well by the Advantage plan. And so that really is a very attractive option. And the beautiful thing about that is you're not terminating. You're just going on that plan. And if you decide you don't like the MA only plan, you can then terminate that during open enrollment and go back on FHB exclusively. And so I think you really have the best of both worlds. Plus, you get the perks on the MA plan that GEHA or FedBlue is not offering.
Yeah. I get gym memberships, dental, vision, all these
those are nice.
extra things.
And it's not permanent.
Yeah. You do a supplemented plan, it is permanent.
It is. And I've had people do it because they had a really lousy FEHB option.
Okay, doesn't reshopping plans make you subject to medical underwriting? So generally speaking, if you're changing from an Advantage plan to a supplement plan, you're going to need to go through medical underwriting. If you're changing from a supplement plan to another supplement plan, you're going to need to go through medical underwriting. However, if you're going from a supplemental plan to an Advantage plan, no underwriting. If you're going from an Advantage plan to another Advantage plan, no underwriting.
Okay.
So maybe you can rewind that if you want to hear that again. Okay, am I able to change my supplemental G plan even though I've recently been diagnosed with skin cancer?
Okay. Well, if it's basal cell, some companies will overlook basal cell, but if it's something beyond that, yes, they're going to. Your cancer look back is usually 24 months. So if it just recently happened, especially if it's going to be melanoma, Merkel cell, some of those kinds of things a little bit more serious, you're going to have to wait until you've had full recovery of that for 24 months. Now, the exception would be if you happen to live in a state that has a birthday rule. And I won't go into all that right now, but there are ways that you can do that. And birthday rule states are California and Oregon and Washington, Idaho, Nevada, Illinois, Kentucky, Missouri. There's about, I think I had them all memorized once. The older I get, the worse my memory is. But the point is there are some states where you can move like to like or like to less plans with no underwriting. And again, it has to be tied around the anniversary of your policy or the birthday. Okay? So anyways.
Okay.
So there's an option.
I will turn 65 in February, I will turn 65 February 29th, 2025. I will still work until I'm 67. Do I have to get Part A and B when I turn 65? My employer has more than 20 employees. The answer to that's no. As long as you're working and covered by an employer-provided plan, again, 20 or more employees, you're perfectly fine with that. You do not need to get A or B. You can get A. It's not going to cost anything. You will pick up B at a later date using a special enrollment period. There's going to be two forms that you're going to use for that. The first one is called the CMS 40B. That's your application for Part B. The second form is called CMS L564, and that's going to be what you're going to provide to your HR department or the benefits person at your company, and they're going to say, yes, Cynthia Randall had insurance, through our company, and she was actively working since she turned 65. They'll put the date back there. And then you'll give both of those to the Social Security office, and they'll process your Medicare Part B enrollment.
Mm-hmm. That's right.
Good.
The only one thing I want to add is that if you do get A and you have an HSA, you can no longer contribute to your HSA. So if you have an HSA, I wouldn't do A or B. If you don't have an HSA, it is fine to do A. A would be in the second payer position. A will not pay in the second payer position any deductibles. It will not pay any copays. It only pays co-insurance. So the likelihood of them paying is pretty small, but they could. But again, I wouldn't if I had an HSA. And the other thing I'd tell her, be sure to compare it. If some work plans are great and some are mediocre, and sometimes it makes sense to go on Medicare while you're still working. You can do that for sure if Medicare makes more sense.
Okay, I'm a client. Was very pleased with your representative, Aaron Butler. He was a huge help for me, so I appreciate y'all very much. Okay, thank you. This is a good segue. So every month throughout the year, our company helps around 1,500 people a month get on Medicare, start their A and B, get their supplemental plan, advantage plan, drug plan, whatever it is. And so if you need help and assistance, there's a phone number scrolling along the bottom. We would love to help you. If you're, and I'm going to do this, if you're a client of ours, we'd love to know, can you put in the comments, just say I'm a client or I love you guys, hopefully you don't say I hate you guys. Put in the comments. We'd love to hear from you. And we really consider it an honor, right? We every person that we get to help, we know there's a lot of places you can go. So we really do try to take our best care of you.
So thank you, Belinda. And
Yes.
you're right, Aaron is a pro. Good guy.
Deborah Woolley, I'll be 65 in July of 2025. I have an appointment with one of your representatives in April. Perfect. 90 days in advance. That's the perfect opportunity.
That's right. Good.
Okay, do you cover Oregon? Yes, absolutely. We're licensed in all 50 states. So anywhere, and District of Columbia.
Yeah.
So if you need assistance and you consider yourself in the U.S., we can assist you.
Yeah, we'd love to. Let us know.
Let's see. I will be 65 next month. I only get $836 a month before Medicare comes out. What plan can I get?
Okay, well, what I would do, Diane, is apply for extra help. At that income level, you really should. And now, when I'm reading this, is that's your total income. I guess you're saying from Social Security. So now, if you have other income, then what I'm saying doesn't apply. But if that's it, then definitely apply for extra help. They will help pay for your Part B premium. And then what I would do in that situation is take an Advantage plan.
Maybe Medicaid.
You should, it would be Medicaid.
Yeah,
You're going to call the state and see if you qualify for Medicaid. They'll cover Part B premium for you, and then you would enroll in what's called the dual eligible. Or it's a special plan for people who are eligible for Medicare and Medicaid, and they're Advantage plans. And quite frankly, they're very attractive. You'll probably have to spend zero out of pocket on a good dual SNP plan. It's called Special Needs Plans for dual eligibles.
Okay, Y Hall, I qualify for Plan F, but went with G. I was told F rates are expected to escalate due to fewer able to enroll, and those enrolled now are aging, which would lead to higher medical costs. Thoughts? I think we agree.
Totally agree with that.
Yeah. Good
Very
choice.
few people are going in F plans, and you're going in a small group, and not going to be a pretty picture in the future.
Okay, Eric VB, the RP United Healthcare Supplemental Plan in 2022 was $152 a month. What is the premium for 2024? We don't know, but it will depend on your state, your age, all these sorts of things. So just look for, if you get a rate increase, look for that letter will come to you in the mail.
Yeah.
Yeah.
ARP is pretty stable, though.
Yes.
About 3 to 5% increases.
Hello, Bruce. Nice to see you. I see you lurking on our Facebook page all the time. Nice to know you're from Rhode Island.
Yeah.
Welcome.
Good to
Thank
meet you, Bruce.
What is cost sharing and preferred cost sharing in a PDP plan? Is that has to do with pharmacies?
Pharmacy.
Okay,
There you
go
Standard.
for it.
Okay, well, that means that there will be some pharmacies that are identified within that particular plan that offer a standard price, which is higher price than a preferred. So every plan will identify a couple of pharmacies, usually it's 2 or 3, and those pharmacies are contracted with the plan specifically, and they have to offer lower prices on meds. I will tell you, when it comes to generics, not a big difference usually, but when it comes to brand names, you can see a sizable difference. Yeah. So I would, if I were anyone, I mean, I'll be 63 here in a couple months, so I'm not on Medicare yet, but I will tell you, I would try to be on a plan that offers a preferred pharmacy that I want to go to. Yeah, for sure. You get better prices.
Tammy says, thank you for all you do. Thank you. That makes us feel good. Carol Graney, what is the Medicare school link for the drug plan? We put in the comments, so it's changemypdp.com. If you're a current client, or if you're not a current client and you want prescription drug coverage assistance, you can go to changemypdp.com. There's a video of Marvin linked to the website where you will be able to shop your meds. Okay. Let's see. Standard versus preferred cost sharing. Okay, I think this guy's trying to answer the questions. Diane Minton, I will be keeping my original Medicare A and B. Could I get a drug plan through you guys without dropping my original Medicare? Go to Change My PDP. Unfortunately, there's just like not, unless I'm reading this wrong, Can I get a drug plan? Oh, well.
Yeah, we don't. Why would you want to drop your original Medicare? Number one, you can't drop Medicare A once you're enrolled unless you have a premium for A, which is very rare. So you can drop B, and the only reason you do that is if you're going back to work and you're covered by a plan that has 20 or more employees in it. So I'm not sure if I understand, Diane, kind of what your goal is here or intentions. And we're happy to assist. You can go to our website on the drug site for sure, but let's make sure you should be dropping these. I assume you're going back to work, but again, if you're enrolled in A, you can't drop A. You can't, unless you're paying for it.
Okay, some of these questions are a little subjective. Is the Advantage plan kind of like a regular HSA insurance plan? The plans were crafted for people who don't have many health issues? Mm-hmm. Not necessarily, although, yeah, not necessarily.
No, they're just replacement plans.
Yeah.
It's a private health insurance company that says, hey, we're gonna take care of you versus original Medicare. Yeah. And when they take care of you, they have the right to add some additional rules than what you would have in original Medicare. So I would not call it an HSA is just a tax advantage way to save money for medical expenses. Pre-tax money and all that. So no, I would not compare the two at all.
Okay, if you're retired and you're on Medicare and you get a part-time job, should you stay on Medicare or get the insurance offered by the employer? And the answer to that is maybe. I mean, it kind of depends. Yeah. What we generally tell people who are still working is, or if they go back to work, is just compare, right? What the cost of Medicare, whether you're on an Advantage plan or if you're on a supplemental plan, what's the cost going to be compared to what's the employer is offering? A lot of people think that they're just going to stay on that employer coverage, and they do a cost comparison. They're like, wow, so I can have, instead of a $2,000 deductible, I can have a $240 deductible for, $25 extra a month or $50 extra a month, and it just makes a lot of sense.
Right.
Yeah. So just compare.
Yeah, I just want to add something to that. If you do decide to take the employer plan, I would recommend just keeping A only. I would disenroll from B. Get off whatever other plan you're on and just be covered by A only and the employer plan. But keep this in mind too. Be sure that once you're after 65, you never want to go without coverage. So if you go on the employer plan and you retire something, you need to immediately go back on Medicare, because if not, you're going to have problems.
Okay, Renee Barotto. I'll be 65 in July 2024, and I've been receiving Social Security payments since I was 63. Will I be automatically enrolled in A and B? And the answer to that is yes.
Yeah.
You're going to get a card about 100 days in advance. In March of 24, you're going to get a card. And here's the biggest thing you need to remember. When you get that card, call the number that's scrolling along the bottom of the screen, and we will assist you.
Yeah,
you're going to be enrolled in A and B, but you're still going to need to find a drug plan. You're still going to need to find either a supplement plan or an Advantage plan, and we'd be honored to be able to help you.
March 15th, about the 25th, Renee, your card is going to show up in the mail.
Yep. So let that be your trigger to call the number scrolling at the bottom. Okay, Tammy Stevens, if you sign up for A, B, G, and D and years later want to go to an Advantage plan, is medical underwriting required? And the answer to that is no. So if there's no underwriting to go to an Advantage plan at all.
That's right.
Ever.
The only requirement is, Tammy, you just have to do it during this period of time we're getting ready to go into, October 15th to December 7th. So your supplemental plan would cover you through December 31, and your new Advantage plan that you selected during open enrollment season would start January 1st. That's the only requirement. That's it. And you got to, of course, be enrolled in A and B.
Yep. Okay, Kay says, my husband will probably be without health insurance when he turns 65 in 2 years. How will that impact his ability to enroll in Medicare?
No impact whatsoever at all. If he's eligible for Medicare, he can start his Medicare, he can get a supplemental plan or Advantage plan, whatever he wants. Previous coverage has nothing to do with it in that scenario.
Carolyn says, if my husband and I both went on Medicare in the last 6 months, do we need to do anything at all during the open enrollment period if we are happy with what we have? Okay. And the answer is no.
Yeah.
You can just leave it alone.
Yeah.
Let it go. In fact, a lot of people that are starting, that started this year or started in the last, few months, 6 months, as long as, you get your annual notice of change letter and as long as everything looks fine, just let it go.
Yeah, just be sure, Carolyn, to read your ANOC, annual notice of change, which relates to your drug plan or Advantage. If you're happy, it auto-renews.
Okay, I'm going to turn 67 in 2 weeks, yet have been covered by an employer health plan, Cigna Open Access. The company covers all health costs. Will work one more year. What do you recommend? Probably just stay there. Yeah, if they're paying 100% of your costs, as long as it's a good plan, go ahead and stick right where you are. about 90 days before you retire.
And not before that.
Yeah,
'cause they
90
don't-
days before you retire, give us a call. That number scrolling along the bottom of the screen. We'll provide to you the special enrollment period paperwork, help you fill it out, help you get enrolled in Medicare A and B without any penalties or gaps in coverage. So the idea is you will be able to transition directly from your employer coverage, the last day of whatever month it is that you stop, and then the first day of the following month is when your Medicare benefits will start.
That's right. That's a great benefit.
From Kansas, can I keep the same plan but change companies without underwriting? The answer to that is no.
No.
If you're on a Plan G and want to go to a different Plan G, you're going to have to go through underwriting. If you're on a Plan N, want to go to a different N, going to have to.
And that's that way in most states, but for sure Kansas.
One of the previous updates. Do you have a link or phone number for people turning 65 in November? So scrolling along the bottom of the page. Hopefully everyone can see that. It's 800-864-8890. 800-864-8890. Call that. We are getting inundated with phone calls. So if you get a voicemail, leave us a voicemail. We'll get back to you. Okay? We're getting literally buried right now with people needing our assistance. And we will get to everyone as much as we can. But yeah, go ahead and get in line. What was the link where I can research changing my drug plan? It's Change My PDP, prescription drug plan, pdp.com, changemypdp.com. Medicare started 10-1. Let's see. Oh, yeah, this is good. This is this kind of Social Security thing. Medicare started 10-1. Social Security started 10-1, but no check until the last week in November. They need to know payment for D&G came out 10-1. Those financially restricted need to know the lapse in pay and due dates. So what this lady's saying is basically Social Security's paid in arrears. So maybe, Pam, you were under the impression that if you started Social Security 10-1 that you would get a check around 10-1. And that's not at all how it works. Social Security, if you start it, is always going to be paid 1 month in arrears. And then it depends on when in the month you were born, depends on which Wednesday of the month that you will actually get your check. What are those?
First 10 days is second Wednesday, next 10 days, third Wednesday, last 10 days of the month, fourth Wednesday.
Yeah.
Yeah.
So
based upon whose ever birthday you're taking.
Right,
spouse would be spouses.
But if you signed up for a Plan D, drug plan, and a G plan, that, or an N plan or whatever, those premiums generally are going to come out either the month of or maybe the month in advance.
Yeah, but the G's not coming out of your Social Security check anyway.
Coming out of
yeah. Your
bank
B
account.
Premium is, and that's probably what you meant to put in there.
Yeah.
But supplemental premiums cannot come out of a Social Security check. It's either a bank draft or a direct bill. So.
Will 2024 drug costs be discoverable before 10/15? The answer to that is yes. They're actually loaded into all the sites. We always just tell people to wait through 10/15 because it seems like invariably like there's some errors or something happens.
Yeah.
So
they should be very accurate 10/15 on, but they're out there right now.
Yeah.
They're available.
My husband was born, and guys, we have 2 minutes left, and we've got a lot of questions. So we'll have to do one of these soon. So my husband was born 10/22/54. Should he be on a different plan? Right now he's on G. G's a great option for him.
Yeah.
He could go to an N, right, if he wanted to save some money. I'm happy to help.
And he qualifies for an F, but I wouldn't go to an F.
Yeah.
Stay on that G plan.
Oh, this is an insurance. Okay. I remained employed with group insurance after signing up for Part B. Retired 18 months after Part B active. Agent and United Healthcare forced me to take Plan F when I wanted G. Is this legit? Yes, it is legit. And the reason for that is you went in under the guaranteed issue rule. And the reason you did that was because you signed up for Part B when you were still working, and maybe you probably shouldn't have.
Yeah.
So you kind of got in this little bit of a loop where you had to do that. Now, what the agent, or if you call us, what we would do is we would ask you some health questions. We would try to get you through on an underwritten G or an underwritten Plan N. Right? There's no reason that you couldn't do that. But the scenario that you or that agent tried to get you to go in was without answering health questions. Now, if you've got health issues going on, then that's probably the best you're going to do. But if you don't, let us know and we can try to find you something different. Okay?
That's a bummer.
Okay, we're going to do one more. And this is for Bruce, because Bruce is always around for us. Hello, Marvin and Josh. I'm on Medicare, have Part A and B. I have Humana for my supplemental plan. My question is this: I had a total reverse shoulder procedure done on 1/2023. Will this affect my premium with Humana coming in 2024? Please advise.
No, they can never single anyone out for what they've cost the company. It is totally a group increase when they occur or an age increase when that occurs. It's not about your claims ever.
It's not like car insurance where if you have a big wreck, they're going to jack your rates up.
Yeah.
You're in the pool of people.
So if they take a group increase of 5%, everybody goes up 5. Whether they've had a claim or 10 claims or no claims, it won't matter at all. Which I'm really glad for you, Bruce.
Yes.
Yeah.
Okay, guys, we have hundreds of comments that we are not going to be able to get to. However, if you need insurance assistance, give us a call, and then we are going to try to do these probably every week or every other week through the annual enrollment period. So hang on to your question, and we'll get to it next time. Go ahead.
Yeah, I was going to say, I'm going to the Chiefs game.
Okay, he's got to get out of here.
Yeah, we have a Chiefs game at 7:15 playing Denver tonight, and I'm going to the game. So thanks for watching, and thanks for letting us educate you and help you. We really, really appreciate the opportunity to serve people.
Yep.
Take care.